I think that it would be advantageous to say that nurse burnout does not exist at the Spine Hospital of Louisiana, but I can say that here at the Spine Hospital, we do everything in our power to minimize and prevent nurse burnout.
Our nurse to patient ratio, we try to keep it 4 to 1. A lot of times it's even better than that. And so that's critical for patient satisfaction, that's critical for our nurse satisfaction.
I've been here since we opened, and it's a great place for nurses. You can be the nurse that you were taught to be when you were in school. You can give the care, you can give the back rubs, you can make sure that they have a pillow under their knees if they need it. I think that the nurses are able to do that, and that makes you satisfied as a nurse.
The next thing is our teamwork. We have nurses who've been here for a long time that they step in and they help each other out, and they kind of set the tone for the younger nurses. Part of that mantra that family does come first, everybody takes that seriously. So if one of my staff members has a family issue, then everybody kind of steps in and, helps them out, fills the void so they can take the day if they need to.
The Spine Hospital has always been very accommodating with my children's schedule. When my mom was diagnosed with lung cancer, they were very accommodating with her appointments and my family time with that, trying to be a working mom, trying to be a good daughter. My team members have picked up slack whenever I've needed them to. Everybody's just been very helpful.
Someone had a spouse who unfortunately had a stroke, and the whole hospital came together, physicians, administrators, and helped with a lot of the funding for those medical expenses. That makes a huge difference in a nurse.
I am a big proponent of your wellness. I think that the nurses need to be able to have outlets outside of the hospital. So I really encourage them to eat healthy, to get some exercise, and we encourage walking around here. The nurses will go sometimes and walk up and down the garage outside just to get their steps in. This room is our favorite room now for the nursing staff to come and regroup, de-stress, talk with other peer members, can come in and focus on deep breathing and focus on themselves, because nurses handle a whole lot of stress daily, and this helps them focus back on themselves and all the good that they do in this facility.
The reality is you have to pay for good nurses. Here we do a good job of assessing the market, assessing nurses' skill level, certifications, combining that information with their experience level and coming up with a really fair compensation.
We get nice Christmas bonuses that a lot of facilities don't get. Our doctors are great for doing that for us.
I think another way that the Spine Hospital of Louisiana helps to facilitate burnout prevention is by providing ways for nurses to advance their career here. I started as a nurse in the PACU, later moving into the pain department, was able to go back to school, get my doctorate, all while working full-time here. I would never have been able to do that anywhere else.
We won this award for being in the top 5% of the nation, which that in itself is great. It's always nice when you get positive feedback from patients that you're being an awesome nurse and you're making them happy and you're doing a great job. Then it's a much bigger surprise when our CNO and our CEO comes around, and not only do they thank you and they give you a big hug and tell you you're doing a great job, but then they're like, oh, we got prizes, and so here's some cups and here's candy and here's food. It's nice to have that pat on the back.
We celebrate everything here, which is fun.
Head staff, our CNO, CEO, Chief Financial Officer, they all get together and throw us this huge crawfish ball. It's super family friendly. You got tons of kid activities. There's unlimited crawfish. They have face painting, jumps and all that fun stuff. I've worked at other hospitals and never once have they ever done that to include the entire hospital, much less your family. It's just an overall really fun experience.
It's a small hospital. You don't feel like you're just a part of this big machine.
If there is a situation where there's a nurse that seems unhappy, they really are conscientious about pulling that person aside, asking them what's going on with their, whether it's something in their personal life, something that's happened at work, anything that can be intervened, they'll do everything in their power to do that.
If you have any kind of tragic event or anything that needs to be discussed, I have an open door. Our CEO has an open door. They can talk to anybody here.
Our CEO sets the tone. He has a mantra that he says, number one, do your job. Number 2, family comes first, and number 3, have fun. And so that just trickles down to the rest of the staff.
You know everybody's name here, and it's a family. It's a family affair here at the Spine Hospital.